Hello, everyone. So, the topic I will be presenting about today is xerosis, which is more commonly referred to as dry skin. So, xerosis, more specifically, is excessive dryness in the outermost region of the skin called your stratum corneum. This dryness is caused by excessive water loss in the skin barrier. As you can see in the figure on the right, there are multiple levels of this condition ranging from very mild symptoms to severe. You can see that as the skin becomes drier, it appears more rough and flaky. These are only a couple of the symptoms, however. You can also experience increased redness, itching, burning, and cracks in the skin as well. Typically, to formally diagnose this condition, a physician will examine patients physically and assess the patient's medical history as well. So, there are many things that can cause xerosis. For external factors, exposing your skin to extreme cold or heat is one of the main causes. For those who like to take long hot showers or baths, you are simply drying out your skin too much. Chemical irritants from soaps or workplaces also contribute to this condition. It is important to pay close attention to the ingredients in the products that you use, and if you work near hazardous chemicals, you need to wear protective clothing. Lastly, cancer therapies like chemo or radiotherapy can also damage your skin too, but unfortunately, there's not much that can be done to prevent this, as fighting off cancer is more important. For internal factors, any pre-existing skin disorders such as dermatitis, psoriasis, and eczema can cause excessive drying of the skin along with inflammation. Hepatitis B and C, HIV, or any fungal or bacterial infections can also contribute. Hormonal changes that come about from pregnancy, menopause, or even aging can also be a factor. For genetic causes of xerosis, the main cause here is a mutation in the filaggrin gene. This gene encodes for the filaggrin protein, which is very important for maintaining the structural integrity of the skin barrier and preventing excess water loss. It was found that mutations in the filaggrin gene resulted in reduced function and production of filaggrin, depending on the type and site of the mutation. This gene often undergoes frame shift or missense mutations, which cause premature termination during mRNA synthesis. Mutations closer to the beginning of the gene sequence often result in more severe deficiencies of filaggrin expression. So when looking at the skin barrier here, you can see that maintaining proper arrangement of the corneocytes and lipids are essential to prevent water loss. When these structures fall out of order, you can see that water can more freely exit the skin and result in it drying out very quickly. Therefore, maintaining barrier function and preventing the loss of excess water will prevent dry skin from developing. Taking a deeper look into the skin barrier here, you can see that the stratum corneum is compactly arranged, with corneocytes stacked on top of each other like bricks, and in between these corneocytes there are lipids. These intracellular lipids consist of cholesterol, fatty acids, ceramides, and sterile or wax esters. All of these chemicals are important for maintaining a strong and rigid skin structure, and so that it can effectively hold on to water. Sebaceous glands are important as well for secreting an oily substance called sebum, which lubricates and protects the skin. Another important component in the skin, located in the stratum corneum, are something called natural moisturizing factors, or NMF for short. These natural moisturizing factors, which are a mixture of amino acids, electrolytes, glycerol, and other acids, essentially draw in atmospheric water like a magnet. They help protect the skin and maintain its hydration and elasticity as well. That is why when there's very little humidity in the air, your skin can become very dry. This is because these natural moisturizing factors cannot effectively draw in water to your skin. Another essential factor for maintaining skin hydration is having a proper skin pH. Ideal skin pH is essential for the skin to function optimally and maintain moisture. Skin barrier regeneration is best at a more acidic pH. At a higher skin pH, around 7 or greater, it can hinder epidermal barrier regeneration. And as you previously just saw, if the skin barrier cannot regenerate damaged cells and maintain its structure, water loss can occur. Your skin's pH is constantly changing based on your diet, sleep, the products you are using, and the environment you live in. So it is important to take good care of your body and protect it from the environment. Also, I should mention that your skin type plays a big role in its optimal pH. It varies from person to person, but there is an ideal pH range, which is slightly acidic, generally between 5 and 6. So while onset of xerosis is mainly determined by lifestyle and genetic factors, age appears to be a fairly big contributor as well. This diagram displays information regarding a study of about 48,000 people and found that 14,000 of those people had xerosis. While all ages can experience xerosis, there's a notable increase in xerosis cases in the older populations. In the oldest populations of 60 to 70, it is almost double that of our age group, which is late teens or early 20s. For the population with xerosis, 30% of them were men and 28% were women. It is not clear if one gender is more likely to develop the condition or not. I could not find many studies on this particular topic. There was one study I found that proposed that women were more likely to develop this condition compared to men, and this may be due to the fact that women experience many hormonal changes with menstrual cycles and menopause at older ages. So gender may or may not be a major factor in developing this condition, but aging definitely contributes. When analyzing skin differences among different ethnicities, the main points to take away are that races other than whites seem to have higher transepidermal water loss, which, if you don't know, is the passage of water from the epidermis to the atmosphere from diffusion and evaporation. Also, whites and blacks tend to have lower ceramide or lipid counts compared to other ethnicities. And as for the rest of the information, it is essentially inconclusive. The main takeaway is that environmental factors more heavily influence the development of this condition rather than ethnicity. For prevention methods of xerosis, as mentioned before with the causes, you need to protect your skin from extreme environmental conditions, along with using good quality products that do not harm your skin. The most important bullet in this list is to stay hydrated. Water is an essential component of your skin barrier for maintaining hydration and also getting rid of toxins. It is also important for pretty much every other process in your body, so make sure to drink plenty of water. As for diet, you basically just want to focus on eating nutritional foods. Eating foods with healthy fats such as avocados, nuts, fish, and olive oil are all good sources. Also, eating fruits and vegetables, especially those with high water content, can provide essential components that help hydrate the skin. You also can take supplements such as vitamins or fish oils, and they provide the building blocks for proteins and lipids in the skin barrier. And probably the last point, which is most important for college students specifically, you want to avoid drinking too much alcohol and caffeine. They are diuretics and dry out your skin. For those of you who like to party up on weekends and rely on tons of caffeine from coffee or energy drinks to get through each week, you're simply doing your skin a disservice, along with your liver and cardiovascular system. In terms of general treatments for this condition, the use of typical skincare products is the most common. These products often contain natural moisturizing factors, lipid replenishing ingredients such as ceramides, triglycerides, and cholesterol, and skin soothing and repair agents as well, like vitamins, keratin, and collagen. Altogether, these ingredients help re-moisturize the skin barrier and restore it back to normal, as you can see in the figure on the right. So the most effective allopathic treatment I found for xerosis is the use of topical urea. Urea is not a steroid. It's actually a natural component in the skin, which is specifically a natural moisturizing factor. There are many different medications which contain urea formulations. The most common is 40% urea and is a cream or lotion. While urea is effective, it is almost $50 for a small tube of the product and is generally more expensive for even higher concentrations. So how urea works in the skin, it works in multiple ways. It firstly promotes shedding of the outer layer of skin and helps remove dead skin cells, which in turn makes your skin smoother over time. And it also increases the expression of genes that code for important proteins and transporters, which help the skin stay hydrated and maintain its defenses. So the use of urea is pretty safe overall, as it does not have many drug interactions, and its potential side effects are not extreme. There is still a lot of information that is not fully known about this treatment, notably with pregnancy, where there are not any studies to determine its effects, but overall it's a solid treatment option for those who do not have any ingredient sensitivities or medical conditions that make the treatment inadvisable. So moving away from the allopathic treatments, now onto the fun part, being plants. The 4 plants I used for my volunteer are aloe vera, rosemary oil, coconut oil, and primrose oil. I chose these plants because they all had hydrating properties and skin healing properties, and I felt they'd be effective for treating this condition. When looking at the safety of these herbs, all of them have at least one safety certification. Rosemary and aloe vera have the most certifications, however they may contain pesticides, but all these plants are pretty safe overall and have a variety of benefits. On to more safety info. Pretty much to take away from this table is you want to avoid using these herbs if you have any digestion issues, and also don't use them during pregnancy. The use of these herbs is also generally safer it's safer to take them topically compared to orally. For clinical trials, all of these herbs showed efficacy and did not cause any adverse reactions. They were mainly beneficial for improving skin hydration and reducing inflammation and also redness. These herbs are also fairly cheap to use for treatment, especially when the dosing is low. So for the treatment plan of my volunteer, I used each plant for 7 days, starting with aloe vera, moving to rosemary, then coconut, and lastly primrose oil. I did not overlap the use of any plants due to my volunteer's request. All of the herbs were used topically, and a thin layer of the herb was applied at night before bedtime. I structured it in this way so my volunteer could basically develop a nighttime skincare routine, and they'd be more likely to remember to do it. It may also help them develop a habit of caring for their skin in the future. For monitoring my volunteer's symptoms, I used a diagnostic tool called a Xerosis, which assesses a patient's skin based off its flakiness, cracks, redness, and itchiness. Each day I would compare my volunteer's skin to the ratings seen in the chart and record the values you see into the table on the left. The baseline for my volunteer started in the moderate range at the 2 spot, and their skin was quite itchy as well, starting at a 6. The main areas that they experienced dry skin was in their forearms and their lower legs. I also recorded the weather and diet of my volunteer for the duration of their treatment so that I could get an idea how their habits may influence the results. The weather in March was kind of all over the place. It seemed to bounce between being either very cold and windy or to being sunny and in the 60s or 70s. Temperature never really rose above this point, but it was fairly humid on some of the rainy days, making it feel warmer. My volunteer mostly spent time inside, whether it was at home or work. They did start walking more, however, it was really only on the nicer days, so exposure to cold temperatures or very hot temperatures was limited. As for their diet, they ate healthy majority of the time. Their breakfast typically consisted of eggs or oatmeal with fruit. Lunch, usually a deli sandwich or salad. And for dinner, it usually was a chicken, fish, or a pasta. In terms of snacks, typically was like a granola bar, banana or yogurt, or sometimes goldfish or like a Rice Krispie treat. And at most 1 or 2 days of the week, they may order out. They might have gotten pizza or like a cheesesteak and sometimes drank a little white wine, but it was very limited overall. Now moving on to results. The first system assessed a scaling or flakiness of the skin. My volunteer is starting at a 2 rating, and all values seen here are based off the Xerosis, of course. The goal is to get all these values to a 0, which is considered to be normal. The scaling of the skin did not go down until week 3 when using coconut oil. Coconut oil is the only herb that produced a change in this category, while the rest of the herbs produced no change. For fissures or cracks in the skin, aloe vera and primrose oil were the most effective. They each reduced it by 1 rating, while rosemary and coconut oil had no effect. After the use of primrose oil in week 4, the cracks in the skin cleared up, and therefore it received a rating of 0. The redness of the skin was reduced by 1 rating each from the use of rosemary and coconut oil. Aloe vera had no effect, and for primrose oil, this category could unfortunately not be assessed due to the redness going away before starting this herb in week 4. For reducing the itchiness of the skin, all of the herbs reduced itching by 1. The pruritus rating began at a 6 and gradually declined throughout the month. In the end, it was reduced to a 2 by the end of the 4th week. Unfortunately, I could not get this value down to a 0, but nonetheless, it is a positive result, and the itching is a lot less bothersome for my volunteer. So overall, all the plants are pretty effective for treating xerosis. The most effective herb was coconut oil, where it reduced symptoms in 3 categories. It reduced flaking, redness, and itching. The other herbs only produced a reduction in 2 categories, but not too far off in comparison. Primrose oil may be one of the more effective herbs as well. However, it was used last in the treatment plan, and as previously mentioned, some of the symptoms already returned to normal by then, so the full extent of its benefits could not be examined. In my opinion, any of the 4 herbs are good options for treating dry skin. The best herb to use ultimately comes down to personal preference. While coconut oil proved to be the most effective, it can be quite messy. So if that is something that may be an issue, then it is not an ideal choice. When comparing herbal treatments to the allopathic one, the herbs win in this case. While allopathic treatments are quite effective, they are much more expensive, and since the herbs were able to produce similar results and are less than half the price, the herbs are the clear winner. And lastly, here are all my references. I hope you learned something, and thank you for listening to my presentation.